Welcome back for another deep dive. This time, we're going to be untangling the mystery of Cushing syndrome.
Ooh, a mystery.
It is. We're going to walk you through the diagnostic process, or basically how doctors figure out what's causing this complex hormonal condition,
Right.
using excerpts from the medical text, establishing the cause of Cushing syndrome.
So it's like a medical detective story.
It is.
Yeah.
We're not just confirming if someone has Cushing's,
Right.
but we're figuring out, what's the root cause?
Right.
Which is really crucial for effective treatment.
Absolutely. Yeah.
So before we jump into all the detective work,
Okay.
what is Cushing syndrome in a nutshell?
So Cushing syndrome is when your body has too much of the hormone cortisol for a long time.
Okay.
And this can lead to a bunch of symptoms.
Yeah.
So things like weight gain and high blood pressure, muscle weakness,
Oh, wow.
and even changes in your mood.
So it's like your body's stress response is kind of stuck on high alert.
Yeah, exactly.
But the source material emphasizes that just knowing someone has Cushing's isn't enough. We need to figure out why their cortisol is so high.
You've got it. And that's where this deep dive gets really interesting.
Okay.
The first clue doctors look at is the level of a hormone called ACTH.
ACTH. Now, is that a friend or a foe in this story?
Think of ACTH as like a messenger.
Okay.
It tells the adrenal glands, which sit on top of your kidneys,
Okay.
to produce cortisol.
Okay.
So if the ACTH is low, it could mean that the adrenal glands are acting on their own, producing excess cortisol without being told to do so.
So they've gone rogue.
Exactly.
But what if ACTH levels are high?
Then that's when the hunt for a tumor begins.
Ooh.
So high ACTH suggests there's a tumor somewhere in the body that's sending out those make cortisol signals like crazy.
So it's not the adrenal glands themselves, but something else is pulling the strings.
Exactly.
And so to find these puppet masters,
Yes.
doctors turn to imaging.
Right. So CT scans are often like the first step.
Right.
They give doctors a really detailed 3D view of the adrenal glands
Wow.
and can help identify any tumors there.
And the source material even includes some sample CT scan images, right?
Yeah.
For us to look at.
It does. So images 1AB and 2AB show examples of what these adrenal tumors can look like.
Wow.
Some are benign, like an adenoma.
Okay.
Others, like a carcinoma, are more serious.
Wow. So even if the tumor is in the adrenal gland itself,
Right.
there are different types with different implications.
Exactly.
But let's say the CT scan doesn't show anything in the adrenal glands,
Right.
but ACTH is still high.
Okay.
Where do doctors look next?
So the most common culprit in this scenario is the pituitary gland,
Okay.
that tiny gland in the brain.
Right.
When a tumor forms here, it's called Cushing's disease,
Okay.
which is a specific type of Cushing's syndrome.
So Cushing's disease,
Yeah.
it's not just a general term for high cortisol. It's specifically tied to a pituitary tumor.
Exactly.
Okay.
But sometimes the source of the problem isn't the pituitary.
Okay.
It could be an ectopic tumor hiding out somewhere else in the body, like the lungs
Oh, wow.
or the pancreas. These can be particularly tricky to find.
So how do doctors differentiate between a pituitary tumor and these sneaky ectopic tumors?
Well, that is a great question because both would cause high ACTH.
Right.
That's where a test called the high-dose dexamethasone suppression test comes in.
Okay.
So this test is really fascinating because
Okay.
it helps doctors figure out who's really in control.
Okay.
Is the pituitary gland calling the shots, or is it being influenced by something else?
Okay. I'm intrigued. How does it work?
Okay, so dexamethasone is a really powerful steroid.
Okay.
When given in high doses, it should suppress ACTH production if the pituitary gland is functioning normally.
So it's like a test of how much control the pituitary has.
Precisely. If the pituitary is the culprit, meaning it's a case of Cushing's disease, it will usually reduce its ACTH production,
Okay.
though not completely.
Okay.
But if the excess cortisol is coming from an ectopic tumor, those sneaky devils are usually resistant to dexamethasone.
Oh, wow.
And they just keep churning out ACTH.
So the dexamethasone test helps narrow down the suspects.
Exactly.
But our source material also talks about the CRH stimulation test.
Okay.
What's that all about?
CRH, or corticotropin-releasing hormone,
Okay.
is like the boss of the pituitary when it comes to ACTH.
Okay.
It's the signal that tells the pituitary to release ACTH.
Okay.
So this test involves injecting CRH and watching the pituitary's response.
So they're basically saying, hey, pituitary, make some ACTH.
Yes.
And seeing what happens.
Exactly. If the pituitary is functioning normally, it will respond with a surge of ACTH.
Okay.
But in Cushing's disease, The pituitary tumor might be so used to doing its own thing that it doesn't respond much to CRH.
It's gone rogue, ignoring its boss.
Mm.
But what about those ectopic tumors? Do they respond to the CRH test?
They don't. So remember, they're the ones sending out ACTH, causing the pituitary to be suppressed.
Right.
So when CRH is given, the pituitary is basically like, I'm good, I'm already getting yelled at enough.
That's funny.
No surge in ACTH.
So these tests are like pieces of a puzzle.
Yeah.
Each one's giving us a different clue.
Yes.
But the source material also mentions a procedure called petrosal sinus sampling. And this one sounds a bit more intense.
It does. This is the most accurate way to confirm if the pituitary gland is the source of the problem.
Wow.
It involves taking blood samples directly from the veins that drain the pituitary gland.
Wow, they're really going straight to the source. How do they even do that?
So they thread catheters through veins in the neck or groin,
Wow.
all the way up to those tiny petrosal sinuses.
Oh, wow.
They then compare the ACTH levels in those samples to ACTH levels in blood taken from a peripheral vein,
Okay.
like in your arm.
So they're looking for a difference in ACTH levels between the pituitary and the rest of the body.
Exactly. They're looking for what's called a central to peripheral ACTH gradient.
Okay.
If the ACTH levels are significantly higher in the blood coming from the pituitary, it strongly suggests a pituitary tumor is the one driving the excess cortisol production.
It's like they're catching the culprit red-handed.
Yes.
But the source material also mentions some potential complications with this procedure.
Yeah, it's not without risks.
Right.
There's a small risk of stroke and other complications, so it's reserved for cases where other tests are inconclusive,
Right.
and a definitive diagnosis is crucial.
It sounds like it's a powerful tool, but used carefully. We've covered a lot of ground so far.
Yeah.
We've talked about using ACTH levels as a clue,
Right.
how CT scans can help visualize adrenal tumors, and sophisticated tests like the dexamethasone suppression test and the CRH stimulation test to distinguish between pituitary and ectopic tumors. We even touched on the intricacies of petrosal sinus sampling.
We did.
But I'm curious,
Yeah.
what happens when these tests don't give a clear answer? What if the results conflicts?
Ooh, that's when the detective work gets even more challenging.
Oh.
So join us for part 2 of this deep dive, where we'll explore those scenarios
Okay.
and the imaging odyssey doctors go through to find those elusive ectopic tumors. We'll also discuss why understanding all of this matters for you, the listener.
Great. I'm ready. Welcome back. Last time we were talking about all the tests doctors use to track down the source of high cortisol in Cushing syndrome.
Right. It really is like a medical mystery.
Yeah.
And sometimes the clues don't all point in the same direction.
Right. So sometimes test results can be conflicting.
Yeah, that's right. One test might suggest that the pituitary gland is involved, while another test points to an ectopic tumor, one that's hiding out somewhere else in the body.
So it's like having multiple suspects,
Yes.
but the evidence isn't clear-cut. What happens then? How do doctors proceed?
It requires a really careful review of all the evidence.
Yeah.
So they have to go back to the patient's history, their symptoms, the results of all the tests.
Okay.
Really looking for any patterns and trying to reconcile any discrepancies.
It's like putting together a jigsaw puzzle, but some of the pieces might be missing or just don't seem to fit.
Exactly. And sometimes it might even require repeating some tests or doing additional investigations
Okay.
just to get a clearer picture, especially when it comes to finding those ectopic tumors.
Right. We were talking about those sneaky tumors hiding out in places like the lungs or pancreas.
Right.
So how do doctors go about finding them?
Well, it often involves what we call an imaging odyssey.
Okay.
Doctors use a variety of imaging techniques,
Okay.
each with its own strengths and weaknesses to try to pinpoint the source of the problem.
An odyssey.
Mm-hmm.
So that sounds like a long and challenging journey.
It can be, yeah. But it's often necessary to get a definitive diagnosis
Okay.
and determine the best course of treatment. Okay.
So what are some of the tools in the doctor's imaging arsenal?
Yeah.
Well, we start with some familiar tools.
Okay.
CT scans and MRI.
We talked about CT scans earlier for looking at the adrenal glands. How is MRI different?
Okay, so both CT scans and MRI give doctors detailed pictures of the body's internal structures,
Okay.
but they use different technologies. CT scans use X-rays,
Right.
while MRI relies on magnetic fields and radio waves. Think of them as like two different lenses,
Okay.
each providing a unique perspective on the body's landscape.
So depending on what they're looking for, doctors might choose one over the other.
Exactly. So CT scans are generally faster and better at visualizing bony structures and detecting bleeding.
Okay.
MRI, on the other hand, provides better soft tissue contrast, which can be helpful in distinguishing between different types of tumors
Okay.
or seeing subtle changes in organs.
Makes sense.
Right.
But our source material also mentions some other imaging techniques, PET scans and something called octreotide scintigraphy. Those sound pretty high-tech. They are, yeah. So PET scans, or positron emission tomography scans,
Okay.
are particularly good at detecting areas of high metabolic activity,
Okay.
which is a characteristic of many tumors. It's like highlighting those trouble spots on a map.
So it's not just about seeing the structure,
Yeah.
but also about seeing how active the cells are.
Exactly. In a PET scan, a small amount of a radioactive tracer is injected into the body. This tracer is taken up by cells that are more metabolically active, like cancer cells, and they light up on the scan.
So it's like those tumors are giving themselves away by being so busy. And what about octreotide scintigraphy? What makes that one special?
Okay, so octreotide scintigraphy is a bit different. It targets specific types of tumors,
Okay.
particularly those of neuroendocrine origin.
Okay.
These tumors have receptors for a hormone called somatostatin.
Receptors. Those are like little docking stations on the surface of cells, right?
That's a great way to put it, yeah.
Okay.
So in this scan, doctors inject a radioactive form of octreotide, which is a synthetic version of somatostatin.
Okay.
And this radioactive octreotide binds to those receptors on the tumor, making it light up on the scan.
So it's like a homing beacon,
Yes,
specifically designed to find those neuroendocrine tumors.
you got it.
It's amazing how these different imaging techniques work, but I imagine all of this testing can be quite overwhelming for the patient.
Absolutely, it can be. It's really important to remember that the patient is at the center of all of this.
Right.
You know, while doctors are using these advanced tools to find answers, the patient's experience and perspective are equally important.
Right, because we've been focusing a lot on the technical side of things.
Yeah.
But ultimately, it's about helping the patient understand what's going on
Right.
and making informed decisions about their care.
Exactly. So in the next part of our deep dive, we're going to shift gears a little bit and talk about the patient's role in this journey.
Okay.
We'll explore how they can be active participants in the diagnostic process and advocate for their needs.
I'm ready. Welcome back. In this final part of our deep dive into Cushing's syndrome diagnosis, we really want to shift our focus to you, the listener.
Yes, because even with all these advanced tools we've talked about,
Right.
the patient's role in the diagnostic process is so crucial.
Yeah.
You are the expert on your own body, your own experiences, and your insights can be invaluable.
Yeah, it's not just about passively undergoing tests.
Right.
It's about being an active participant in your healthcare journey.
Exactly. It's a partnership between you and your medical team.
Yeah.
And like any good partnership, it requires open communication and a willingness to ask questions.
So what are some key questions someone should ask if they're being evaluated for Cushing's syndrome?
Well, don't be afraid to ask about the suspected type of Cushing's syndrome, the potential causes of your high cortisol, or the specifics of any tests being ordered.
Right.
You know, you have the right to understand what's happening and why.
It's about being informed and empowered. And sometimes advocating for your needs means speaking up if you're feeling overwhelmed or need more information.
Absolutely. If something isn't clear, just ask for clarification. If you feel it's necessary, don't hesitate to even seek a second opinion.
Yeah.
You know?
Remember, this is your health.
Yes.
You deserve to be fully involved in the decision-making process,
Absolutely.
especially with a condition like Cushing's, where the diagnosis can be complex.
And this is where the patient's own observations become so important, you know?
Yeah.
Remember those cases where test results might conflict?
Right.
Well, sharing details about your symptoms, how they've changed over time, any medications you're taking, even things that might seem totally unrelated can help your doctor connect the dots.
It's like you're helping to fill in those missing pieces of the puzzle.
Exactly. And one way to be more precise in your observations is to actually keep a journal of your symptoms.
Oh, that's a great idea.
It can really help you track patterns.
Yeah.
And provide your doctor with a much more comprehensive picture of your experience.
Journaling is a great tool for self-awareness, too.
Oh, absolutely.
It helps you tune into your body's signals.
Yeah. It also helps you communicate more effectively with your doctor.
Yeah.
But remember, it's not just about asking questions and sharing information.
Right.
It's also about advocating for your needs.
Mm-hmm.
You know, if you're feeling overwhelmed or need more support, don't hesitate to ask for it.
Whether it's from your doctor, a nurse, a therapist, or a support group, having a strong support system can make a world of difference in navigating this journey.
Absolutely. There are also many resources available online. Remember those up-to-date articles we mentioned in our source material?
Right, yeah.
Those are excellent sources of reliable information written in plain language.
Right, so doing your own research can be empowering,
Yes.
but it's always a good idea to cross-check your sources
Yes.
and discuss any information you find with your doctor.
Definitely. It's about being an informed patient and working in partnership with your healthcare team.
Yeah.
Trust your instincts, ask questions, and don't be afraid to speak up for yourself. The more empowered you are, the better equipped you'll be to navigate the complexities of any health challenge.
That's such a powerful message. It's a
Yeah.
reminder that we're not just passive recipients of healthcare.
Right.
We can be active participants in our own healing journey.
Exactly. And as we wrap up this deep dive into Cushing's syndrome, I want to leave you with one final thought.
Okay?
Remember that Meteropone stimulation test we mentioned earlier?
Yes.
The one that used to be more common but is rarely used now.
Right. The source material mentioned it, but didn't go into a lot of detail.
It raises an interesting question. Why do you think that test fell out of favor? Could it be that newer, less invasive tests emerged? Or perhaps it had limitations that made it less reliable? It's a reminder that medical knowledge is constantly evolving.
That's so true. What we know today might be different tomorrow. And that's why it's so important to stay curious, stay engaged with your health, and never stop asking questions.
Knowledge is power, and the more you know, the better equipped you'll be to advocate for your well-being.
That's a perfect note to end on. Thanks for joining us on this deep dive. We hope it's empowered you to navigate the complex world of Cushing syndrome diagnosis and be an active participant in your own healthcare journey.
Until next time, keep exploring, keep learning, and keep asking those important questions.